Well, I work with children predominantly, and so for kids it's interesting because a 2-year-old is very different to a 13-year-old, and so you have to adapt what you do to be on their level. So it's about getting down on their level for a child. Sometimes it might be singing a song if they're a baby or an infant. Telling a joke to some of the older kids works really well. But whatever it is, it's just making them feel comfortable. And then obviously then with kids, you've got the parents or the caregivers with them as well, and it's about making them feel reassured that we're going to be able to safely look after their child in this really important time.
It starts from the very first moment that I meet them. I ensure that I greet them, I use my first name, I pronounce their name correctly. I try and greet them in their own language if it's possible. It's very easy to use Google Translate and make sure you get it right. And I explain my role as an anaesthetist. I do tell them actually that I'm a doctor, that our training is very comprehensive, and that you have to do medicine for 6 years and work for another couple of years as a doctor, and then train in anaesthesia for at least 5 years before you can become a specialist. How do I convince them that they're safe? I think that's one of the joys of anaesthesia for me, actually, because you've got a very short period of time to convince someone that you are trustworthy and that you have the skills to keep them safe through the entire operation. So I usually say my patter about, I'm going to listen to every heartbeat, I'm going to listen to every breath you take, I'm never going to leave your side, and give them the confidence that I have the skills to ensure that they wake up safely.
I see my role, particularly when they're just about to have surgery, and I have a couple of different sort of interests that I have. One of them is cardiac anaesthesia, patients having big cardiac surgery. So I mostly see my role in that immediate preoperative period as just calming patients, relaxing them. I'll often talk about things not related to their surgery. I often ask them about their families, where they grew up, how many kids they've got, grandkids, and I find that sort of relaxes them. I tend not to discuss the kind of risks and things like that at that point. It's mostly just a reassurance and just really trying to relax them and calm them down as best I can.
One of the things that I recall as just good medical practice was what I learned as an anaesthetist, and that's going and seeing the patient beforehand, letting the patient know that you're taking an interest in them, and you're not ticking boxes. So listen to what the patient has to say, be careful, you hear what the patient's worried about, and you allay their fears as best as you can, explain to them what's going to happen. And then there's another part of this. The fact that they've seen you beforehand, perhaps in your civvies or something, and then they see you in the operating theatre, and you're still the same person, still jolly, reassuring. That's a really important thing for a patient. And then afterwards, an incredible thing for patients was when I used to visit them post-operatively on the ward, and explain to them what had gone on from my side of things. Now that is just simple good clinical practice.